Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Do you know what bronchitis is? It's a condition where the bronchial tubes, those airways that shuttle air to and from your lungs, become inflamed. Imagine trying to breathe through a straw that's been squeezed tight. Not very pleasant, is it? Bronchitis comes in two distinct forms: acute, which is short-lived but intense, and chronic, a longer-lasting, recurring type. Now that we know what bronchitis is, let's delve into what causes it. What causes bronchitis, you might ask? Well, bronchitis is primarily caused by viruses, the same ones that can give you a cold or the flu. However, bacteria can also play a role in bronchitis, particularly in cases where the infection persists. But it isn't just about microorganisms. Lifestyle factors, such as smoking, can significantly contribute to the development of bronchitis. In fact, smoking is the leading cause of chronic bronchitis, a long-term form of the condition that can drastically affect a person's quality of life. And we can't forget about environmental factors. Exposure to substances that irritate the lungs, like dust, air pollution, or certain fumes, can also lead to bronchitis. This is especially true for people who work in environments where these irritants are prevalent. Acute bronchitis often follows a cold or other respiratory infection, while chronic bronchitis is typically the result of long-term exposure to irritants or smoking. Understanding the causes of bronchitis is vital, but recognizing its effects on the body is equally important. How does bronchitis affect our bodies? Well, bronchitis essentially inflames the bronchial tubes, which carry air to and from your lungs. This inflammation can lead to persistent coughing, often accompanied by the production of mucus, which is your body's way of trying to clear out the irritants. You might also experience shortness of breath, a common side effect as your body struggles to get enough oxygen. Fatigue is another typical symptom. Your body is working overtime to fight the infection, and this can leave you feeling rather tired. In some cases, you might also have a mild fever and chest discomfort. Now, if bronchitis becomes chronic, it can pave the way for more serious conditions. Pneumonia, an infection that inflames the air sacs in one or both lungs, is one such condition. Another is chronic obstructive pulmonary disease, a progressive lung disease that makes it hard to breathe. Bronchitis can take a toll on our bodies, but how can we identify it? What are the red flags that might indicate bronchitis? Bronchitis often sends up some clear signals which can help us identify it. One of the most common indications is a persistent cough, which might be dry or may produce mucus. This mucus can be clear, white, yellowish-gray, or even have a greenish color. Another symptom is a feeling of fatigue or tiredness, which may be accompanied by shortness of breath. People with bronchitis often find it difficult to breathe, especially during physical exertion. A mild fever can also be a sign of bronchitis as the body fights off the infection. This fever is usually accompanied by a sense of discomfort in the chest area. It's important to remember, though, that these symptoms can often mimic other respiratory diseases. Therefore, a proper diagnosis from a healthcare professional is necessary to confirm bronchitis. Knowing the symptoms gives us a heads up, but how can we prevent bronchitis? What can we do to prevent and treat bronchitis? Bronchitis and inflammation of the bronchial tubes can be prevented and managed with a few thoughtful steps. One of the most effective ways to prevent bronchitis is by quitting smoking. Cigarette smoke irritates the bronchial tubes and contributes to their inflammation, so it's crucial to kick the habit if you're a smoker. Even if you're not, avoiding secondhand smoke can significantly reduce your risk of developing bronchitis. In addition to smoke-free living, practicing good hand hygiene is another key preventive measure. Germs are everywhere, and washing your hands regularly can keep those pesky microbes at bay, reducing the likelihood of a bronchial infection. Getting vaccinated is another crucial step in the prevention of bronchitis. Vaccines for influenza and pneumonia can help protect your bronchial tubes from infections that could lead to bronchitis. As for treatment, it usually focuses on relieving the symptoms of bronchitis. This may include over-the-counter medications to reduce fever and treat coughs, or prescription drugs for more severe cases. Pulmonary rehabilitation, a program that helps improve lung function, may also be recommended. In severe cases, oxygen therapy might be needed to ensure the body gets the oxygen it requires. Remember, each person is unique, and so is their treatment plan. Always consult a healthcare professional for advice tailored to your specific situation. Bronchitis can be a serious condition, but with the right knowledge and precautions, it can be managed effectively. UMCCC, your ultimate medical consultant connectors. Kindly subscribe, like, and share.